Hi, my name's Angela. In this video, I'm going to be talking about helpful apps that I use in pharmacy. This is kind of a different video, but I thought I would just cover some apps that I think are helpful or have been useful to me in my pharmacy, like education and daily clinical work. So if that's something you're interested in, then just keep on watching. So one thing just to underlie all of this, if your preceptor on your rotation says that you can't have your phone during rotation hours, but you have one of these apps, I strongly suggest you ask them if you can use the app or use that phone for that reason. There's so many helpful apps these days because phones have become so vital to all of our lives. So I would just try to advocate for yourself if you need to. You'd be surprised what preceptors didn't know that there was a helpful app, and then all of a sudden they're using it too. You just have to be careful if they grant you that privilege, kind of what you do with it. So my first area is clinical apps, and obviously I'm recording this on my phone, so I can't show you the apps, but I'll put a link to them below. So the first one is a paid app. It's called Doximity. It's intended for providers to use for many different functions, so telehealth, calling, texting, news updates, things like that. I use this for its phone function, so it lets me call patients from a number that's not my own personal number. So it disguises my personal information, but lets me use my cell phone. I think someone once told me that you could press like *88 or something and you would be able to mask your phone number from others that you call. That never worked for me, but Doximity works for me. And I use this a lot as a pharmacy student and right now as a resident because I move around a lot. I don't have a set practice location. And so I don't have like a work phone that's really close to me, but I always have my personal phone. So I find it really easy and efficient to use Doximity. I can set different profiles. So if I'm at one clinic on one day, it shows me from calling from that number versus another. And so I use this all the time, mainly for calling because my work doesn't use it for any other reason, but I use it all the time. The next app is LexiComp. This is a paid app. This is a drug information app. Having a drug information resource that's like readily available is extremely helpful in my opinion. So my organization that I've worked for has always provided some sort of drug information resource. Next year, hopefully when I'm employed, I'll have to buy my own, but I will definitely buy it because it's worth it. I prefer LexiComp because of its evidence-based background and kind of research to back up its evidence-based practices, but really any drug information resource that's helpful. Really just something kind of at your fingertips or that you can use to show patients would be, I think, fine. So Micromedics, Dynamed, Clinical Pharmacology, those are all other drug information apps. I just personally like LexiComp. I find it very easy to navigate on my phone. The next one is free. It's the ASCVD risk calculator. So I'm in the primary care environment, so managing hyperlipidemia, diabetes, things like that. So the calculator is very helpful for me in that regard. It has a web version that I use also a lot, but I think the app is really helpful. And so if you don't know what that is, it's a 10-year ASCVD risk score, helps guide decisions and discussions on like aspirin, statins, and other therapies. So the ACC runs it, and yeah, I would just encourage you guys, if you haven't thought about it, to use it. Maybe it'll help you calculate your ASCVD risk scores a little bit faster. The next one is days between dates. And so I've never thought I would use this, but if you're someone who orders labs or you schedule appointments or medication day supplies, tracking adherence, things like that, this calculator is very helpful. It just basically tells you how many days are in between two dates. So you can enter dates that are already existing and you just want to know how long it's been since a patient's followed up with you, or if you're scheduling out something 90 days in the future and you're like me and you're terrible at doing that in your head, you can just use this app. So I think it's great, especially for labs that have to be a minimum of certain days in between, like A1C has to be a minimum of 90 days in between. I find it really helpful. And then last clinical app are just continuous glucose monitor free apps. This is if you're in the world of primary care or endocrinology or diabetes. So Dexcom and Libre, those are two apps that have continuous glucose monitor functions. And so I spend a lot of time in my clinics right now talking about them. And sometimes patients are like, what does the app look like? And I'm like, how do you download it? If I just have it on my phone and show them, it's way easier than like pulling it up on a browser or pulling up my app store. So just having it available to me seems to save some time. So those are all clinical related. Now I'm gonna go on to some operational, just managing yourself, managing a practice, organizing things. My favorite app that I really wanted to mention is called Genius Scan. I use this probably on a daily basis, not just for patient care, but for myself, for personal life, just whatever. So basically it is an app that's free. There is a paid version, but I don't have it. And it allows you to take pictures of things and turns them into PDFs. So it's basically like a picture scanner. So it becomes black and white. Sometimes when you take a picture, it'll be color, but you can try again and make it black and white and act like a PDF. So I've used this a lot for like PAs when I need a physical signature and I need to quickly send it to myself. Again, moving around a lot, it's kind of hard to find a scanner or a copier, things like that close by. So having it on my phone is super accessible. You have to be careful with personal health information. So within the app, you can choose what email you send it from. And so if I'm sending it from a PHI secure email to a PHI secure email, then it's okay. But if not, then you have to kind of wonder if you're breaking some sort of HIPAA rules, but maybe even if the pro version allows you to be more specific with that, I don't know. Another reason to advocate for your phone in the room. I can't tell you how many times a patient has had blood sugar logs or had something and I've said, hey, can I just take a picture of this real quick? I'm gonna record it in your chart. We don't have time for me to do that right now in front of you. And that way they can take it home with them and I can still get the work done. So love, love, love that app. The next one is a scientific calculator. So beyond your basic calculator, I just appreciate it having everything I need. I don't have to wonder. The free one, I think I'm gonna link down here, has some sketchy like ads and maybe a paid version would be better, but I use this occasionally and find that it's nice just to have more functionality. And then the last one is a stopwatch, which should be free with your phone. So I use a stopwatch and a timer in between patient visits and also during patient visits. So be discreet with it because sometimes it can make people anxious if you think you're timing them. But when I first started running visits, it was very hard for me to stay on time and stay on task. So stopwatches, even in the corner of my computer or in my phone, really helped me just stay on task and know how much time I was spending on things. So it just has a potential to carry anxiety, so just use it with caution, but I use it a lot and I find it very helpful. So the last thing I'll say is just ask your preceptors or your colleagues or your friends what apps are helpful for them. You never know when there's going to be a good idea or when you can have an app that maybe you don't use but a patient could benefit from. There's a really good medication adherence app that I still have yet to use, but I know that if I ever get in need of one and have a patient that might need it, I can go to that app immediately because I've heard so many good things about it. So just ask around and there'll be a new app probably by the time I post this video that's helpful. So just keep on refreshing your mind about what could be helpful for you in your life. So I hope this was helpful. If you liked the video, go ahead and like it. Share it with someone who you think it could be helpful for. If you have any ideas for videos that you want to hear of, just go ahead and put them in comments below. And I will see you guys next time.